So we're going to go ahead and get started. I'll come back and try to, if anyone else joins the call, you will give them a chance to announce themselves here periodically. So I'm going to let Kaufman and Associates go first, simply because they're on the call. So Kaufman and Associates, we talked about this a little bit at our September. When was that? Was it the 15th? I think it was September 15th meeting. But CMS, if you go to cms.gov, you'll see Outreach and Education as one of the tabs. And if you click on that, you'll get to Tribal Affairs or American Indian Alaska Native, and then you'll see Tribal Affairs, and there's the Technical Assistance Center. And that's what we're talking about today. It's part of the CMS.gov website. And CMS is under contract, or Kaufman's under contract with CMS to put our U.N.I.T.E collaboratives onto that website. And that's why Julie and Jonathan are on this call. So we've talked about this before. We have an official brochure now, thanks to Melissa Heflin in Alaska. So we have our brochure. And we talked a little bit about what content we want on the call. So I'm going to let Julie just give everyone a quick refresher on what's going to be included, and then she would like a little more feedback from everyone on this call so we can really nail down what that piece of the CMS.gov website will look like. So go ahead, Julie.
Okay, thanks, Debbie. So as Debbie was describing, that we with CMS are developing a section on CMS's Long-Term Services and Support Technical Assistance Center, a section dedicated to tribal nursing homes, which ultimately is a nice platform to highlight all of the U.N.I.T.E work. And so what the section, or what Kaufman is responsible of doing, is developing content to put onto this website. And so there are specific elements that we need to create. And so that's where I'll need your input and your preferences as to what you would like to develop as far as this content is. And so I was just going to describe a little bit of what those elements are, and then maybe we can talk about how we can use the website and kind of just brainstorm some ideas. So some elements that we are required to develop content for is they're calling it the Quarterly Best Practices Report on nursing homes in Indian country. And so it would just be a quarterly report that comes out that just highlights best practices that are being followed within nursing homes. Topics are undefined, so this is a really great way of highlighting and focusing some research and getting to talk with nursing homes about the work that they do, and then putting it into a nice little document. And so the first one that we are putting together will be put together by December 1st. And then from there on out, it's about every 3 months. Next, we're going to go ahead and we are recording all of the U.N.I.T.E calls and making transcripts of them. So it's a good way to just record and have a resource and an archive of the discussions here as a point of reference. And so CMS has a YouTube channel, which we then will post all of the meetings and the recordings and the transcripts too. And there will be a link to this YouTube channel on the web page. On this web page, we also have all the webinars that have been completed within the past 2 years. I know we did a tribal nursing home series in 2015, and again, we did another 2-part series this year for 2016. I would like to see that continue to go on and have another series for 2017 as well. And so all of those links are posted on there as well.
Okay, Julie, is it after 2 years, then you just delete them? It only goes back 2 years?
For?
When you said the webinars where the links are there for the last 2 years, do you just update that like once a year, or is it like every month you take off one and put the new one on? How do you do that?
Oh, no, it's a running archive.
Okay.
So CMS they have an LTSS webinar series.
Right.
So they have, yeah. And so the nursing home webinars were part of that series, but we went ahead and take just those two and put them on the new section. And we'll just keep running those. Yeah.
Okay. So just as an insert here, you all know that next week, Wednesday, is the Tribal Affairs webinar, the one that's always the fourth Wednesday. And that's on, isn't Julie, that's on flu, right? Caregiving and influenza vaccines?
Yep. We'll have a couple folks discuss the importance of the flu vaccination in regards to caregivers. Mm-hmm.
Okay, perfect.
Yeah, so I think that was a lot of information. So I'll go ahead and pause and answer any questions that there might be, and then perhaps we could brainstorm a little bit about some topics or ways to conduct that KAI could conduct best practices reports.
And KAI is the company that you work for?
Correct. KAI is Kaufman and Associates Incorporated.
Okay, and I want to remind everyone really quickly that we also have a website. I think most of you have been to it, but if you haven't, you need to go take a look because we've made some changes. It looks really good. It's the www.tribalnursinghomes.weebly.com. And so all the stuff that's on our Google Calendar is actually also on there. So when I post something on our Google U.N.I.T.E, the drive that we share, it actually goes right to that website, too. So I don't know, Julie, if there's some way, because we have a Google Calendar and a Google, like all the documents we create that are shared with collaborative members on our Google Drive, can that be embedded in there somewhere?
A calendar embedded onto the webpage?
Uh-huh.
Potentially. I could look into that. Yeah, that's something that we could consider. At this point, we do have a direct link from the web page to the U.N.I.T.E website.
Okay, good.
Yeah. And I guess I didn't really say this, and just to make it clear, the purpose of the web page, because it is on the Technical Assistance Center, it's more like a hub of resources. So if people really wanted to get, a good sense of what is the landscape of tribal nursing homes, they can go to this webpage and see kind of all of the work that y'all have done. And we'll get a really good sense of what's happening and, what you guys are working towards. So it's just, it's a nice hub. It's a nice place to store information and resources. And so that's the purpose. It's a great opportunity. So.
Right. So does anyone have any thoughts on this idea of a quarterly best practice report and what that could look like? What would we like that to look like?
Well, this is Lisa, and I guess one thought I have is that at our annual meeting, we'll be discussing what our topics and areas of focus are going to be for the next year. So I kind of feel like it might be a little hard to flesh that out right now. We could certainly do some best practice, have the first quarter be sort of a report out of the best practice work that we've done already around the traditional foods.
Uh-huh.
But moving forward, I think it might just sort of depend on our topics that we're going to be working on.
Mm-hmm, exactly. And just to remind everyone, what we decided at our inaugural meeting last year and moving forward this year was to have kind of a topic of the year. So we want to kind of look at, it's decided on at our annual meeting, and then that's what we really focus on. And we can break it apart as much as we want to. So we don't really know what we'll do yet for 2017, but that would determine, like, say, some of the webinars we might want to present. Or we may want to do a poster presentation again at NCAI or NICOA. Okay, but, we're going to have a focus, like, for next year. So that may, Julie, that may, we may have to wait till after our meeting, which is November 15th.
Mm-hmm. Okay.
But just in general, does anyone else have any thoughts on this idea of a quarterly best practice report and how that might look?
I think the idea is, I couldn't answer on how it would look. I mean, I guess it would look at, the templates we come up with.
Okay. So we may need to devise. Julie, do you have templates, or are we going to have to come up with those?
No. That's the thing is that Kay and I will go ahead and we will develop a template. We will put everything together. I think what would be most important would be to think about, how you would want to choose a topic to look at, and maybe even because I know we talked about this a little bit, Debbie, and I'll go ahead and just say it again here. Is one approach to this would be, I know that y'all have focused on traditional foods for the past year, and one way we could to get a really good, in-depth look at the work you did, and pull out the best practices would to focus each report on a different aspect of traditional foods and the best practices that are involved with that. So what are the best practices in, working with the state, or what are the best practices in, food preparation, or something like that. I mean, that would be one approach. So how would you guys like to address, to play around with the best way to get this information out, or what you want to share?
So I think for December, because you're thinking in January we would start with our new topic, right? So December, it'd be March again, maybe April, May, June, September. So maybe just for December we can give you, if you give us a template, we'll kind of fill it in, flesh it out with, all the stuff that we've basically done for this year. And then going forward, Lisa, when we have our, when we're working on the topics, we will keep this report in mind, so we can organize it with this report in mind to say, okay, let's go work on this, and it'll be reported out quarterly, which I think is a great opportunity. Great opportunity.
And this is Lisa. Of course, QIO people always are interested in data. So I think if there's any way, and again, something to think about as we're planning for the next year, to have some data to say, look, we've looked at this, whatever, and topic, and here's some data that says we need to work on it, and then we can, of course, at the end of the year, collect some more data to show we've made an improvement. I think that's always really powerful.
Right, and that's why we're working with the QIOs, because we want to be thinking that way. Very good. Good. Anyone else? Okay. So, Julie, thank you for being on the call. I know we missed a call yesterday. I had to cancel, so Julie's going to set up another call just to talk about what resources the people we work with and how we want them listed as a resource on our section of this website. So other than myself and Melissa, would anyone else like to be on that call with Julie? If you could speak up now, she can give you the invite.
Yeah. I'd like to try to be on the call.
Okay, is that Joseph?
Oh, I'm sorry, this is Val.
Oh, sorry, Val. Okay. So Julie, Val Creil, please, Kreil.
Okay.
Anyone else? So it's myself, Melissa, and Val. All right. Okay. Thanks, Julie. I appreciate it. With Jonathan, did you need to say anything?
No. I was on here just for support.
Okay, very good.
Thanks. To take notes.
Okay, thank you, Jonathan, for being on the call. Was that okay, Julie? Was there anything else?
Nope, that sounds good. Also, just as a follow-up for myself, what I'll go ahead and do is I'll work up a template and send that out to you so we can have like a few months to develop what will be in the report. So I'll send that out to you, Debbie, and then you can send it out to the group, or
perfect.
Who should be? Okay.
Yeah, that'll work. That'll work, Julie. That'll be good. The sooner we get that, the sooner we can start filling it in. So that's great. All right. Thank you very much. Okay. So, Lisa, would you talk briefly about the survey that we're going to send out to all our membership and how important it is?
Yeah, you bet. At one of the last calls, we were talking about trying to get feedback on, number one, sort of how we did this last year, and also some planning for next year, what topics are of interest, and also asking if folks might be attending the annual meeting. So I did do a draft mock survey monkey on that. I shared that with Debbie, and am open for edits, corrections, and or suggestions.
Okay. I thought it looked great. Did anyone else see it that's on the call?
I only sent it to you, Deb.
Oh, okay. I think I sent it to Melissa, though.
Okay.
And she was going to get back to me, and I'm not sure she did or not. I thought it looked great, Lisa. I thought it was really well put together. The important thing about this is we wanted this information back before the annual meeting, so we're probably going to be sending it out. What do you think, Lisa, like next week?
Yes, I know. Probably no later than.
Part of the reasoning and rationale here is that we are asking the University of Arizona GWEP to pay for our annual dinner meeting, and they have to have all the information. Like, they need to know who's going to be coming to that dinner meeting by like the end of next week. So it's really important that when you get this survey that you do RSVP to it or answer it, so we have some idea who's going to be attending. And I'm going to take a show of hands here in a minute about our annual meeting, because we really got to nail that down here pretty quickly. The only thought that I had, Lisa, on that survey, what about asking people to kind of list out or give them a checklist of services that they offer? Because that's something we could use for our presentation.
What do you mean?
You know, so for each tribal facility, do you have this? Do you have this? You know, do you have on-site physical therapy? Do you have, hospice and palliative care? Do you...
Will you send me that question, how you'd like that question, and I'll be happy to add it.
Okay.
You sound like you have an idea of what you want. It'll be a whole lot easier if you just shoot that to me and I just plug it in, if you don't mind.
Yeah, that's fine. I was going to talk to cool people today, but I think it's going to take too much time.
Yeah.
Okay. All right, hold on, I'm typing. All right, so anyone have any questions for Lisa about the survey, or anyone have any definite thoughts on something you'd like to add to the survey? I know you haven't really seen it, but we're basically just saying, Lisa, I forget, it's not in front of me.
I don't have it pulled up either.
I think there were 6 or 8 questions, right?
Very, very, very few questions. One was just asking about the U.N.I.T.E collaborative, sort of, are you participating?
Right.
And then finding out a little further, are you planning on attending the annual dinner planning meeting? Ranking some of the topics that we kind of kicked around staffing, board education. I think dementia training was maybe one of them as well.
Right. Okay.
And then I think left a couple of comment blocks as well. You know, what are we missing? What other thoughts do you have about this?
Okay, so if it's okay with everyone on the collaborative, Lisa and I will tighten this up and we'll send it out early, first thing next week. If you could all, this is so important, because we cannot, we've got to get this information back. So if you could please take a minute to just answer these questions as a collaborative member or interested party. Just take a minute. Even if you're not, actually don't represent a facility, like if you're an ombudsman, or that's fine too. Just, give us the best information you have, because we want to continue to make this, we want to be very inclusive on this collaborative. And one thing Julie didn't mention, but Julie, you said there were 22,000 people on your tribal affairs listserv, correct?
Yes, that's correct.
Jonathan, yeah. So, that's a lot of people that potentially are going to hear about this U.N.I.T.E collaborative. So we really want to make it the best we possibly can. So thank you for taking the time to do that survey. The next thing is, Melissa, are you on the call by any chance?
I think she's at the Alaska Federation of Natives conference this week.
Oh, okay.
I'm here.
Who?
Brandella Bluehouse with NICOA.
Oh, Brandella, great. Could you give us a little update on NICOA and how the conference went in September? We were so thankful to be part of that.
Yes, it was wonderful. We held the panels on long-term care, and we just didn't know who was supposed to speak from your end, and I think there was a miscommunication there.
Oh,
So we
sorry.
had, starting programming, but there was workshops offered, and so there was workshops in this area. And I think the conference went well, except for the fact that we were competing with the area. And we learned quite a bit from that experience. So,
tell them where you were.
We were in Niagara Falls, New York. And it was absolutely gorgeous, too. The weather was perfect.
Okay.
People went out, and they enjoyed the location and just had a great time. But the morning hours seemed to be more well-attended, and the afternoons kind of people filtered out to do other things. But overall, I think there was quite a number of, there was a great attendance.
Do you know what your final attendance was?
We're still trying to determine how many people actually attended, but we had well over 1,300 people.
Wow. Wow. And those were all mostly elders, right?
Yeah, they were mostly elders. I'd say about 95% elders, and the remaining about the tribal leaders and other individuals.
Wow. That's awesome.
So, and also we had some resolutions that were passed at the NICOA conference, and one of the resolutions was the one you offered.
Oh my gosh, that is so exciting! So I don't know if you all remember that we typed up a resolution about traditional foods in tribal nursing homes, and that was going to be voted on and would be sent to NCAI. Oh my gosh, that is so exciting!
Right. Well, we did make a few edits to it because we wanted to include aging service facilities.
Wonderful.
And the law does include. So we wanted to make sure that it was all inclusive of the service providers across Indian country. So we made a few adjustments, and it has gone to NCAI, but because we missed, I believe it's because we missed the deadline, they wanted it 35 days or 45 days out.
Okay.
And for the deadline after that time. So we submitted, so right now they're still in tabled position. So I'm hoping if we are able to have them reviewed, perhaps they will take it.
Do you know, will that happen then at their next conference? Will we have to wait till then?
I think we're going to have to wait till then. I'll double check, though, to make sure. Because, yeah, I think those. And those were... Yeah. I'm going to find out more details. It's still too new after the conference, so time frame is still, I think they're still adjusting a few things.
So, Angela, do you know when NCI has their next conference?
I believe, I'm not sure. I'm going to have to double check on that as well. I don't want to give you wrong information.
That's okay. And when is your next conference?
Our next conference is in 2018, around September.
Okay, so you're every other year.
For every other. But we do have an approved resolution from the elders that you're welcome to have and use, and other entities so that the NICOA are in support of served at their nutrition programs and long-term care programs.
So you're cutting out just a little, but so I just want to make sure, could you please send to me that final resolution that was amended so I can send it out to everyone on U.N.I.T.E?
Absolutely.
Okay.
Yes. And also, I just wanted to mention that, reading about that program, about the traditional foods program, we kind of came across some information that the states are supposed to be supporting that project. But again, there has been little activity in terms of this program, and so without really that was more support. I'm hoping that as we inform the community and get more information out there, that people will start educating tribal about how to access information and how to set up their nutrition programs to allow for these services.
You're cutting out a little, Randella, just so you know, but just so everyone heard, she's talking about setting up nutrition programs to be in line with this type of resolution.
Right, and what I've also discovered is that there's very little information out there. The state, especially working with the tribes to help implement the programming for serving traditional foods within their centers, but there's very little activity around that right now. I think there's just not that support coming out from, I think, the federal to the state and then back to the tribes. So there's got to be something to encourage that full level of support and training.
Right.
There's a lot of training involved because there's requirements that are required before you open your facility up to receive donated food items and as well as traditional foods.
Right.
There's a level of, I guess, bureaucracy that's involved and has to be dealt with.
Right, and I know that Val Trail, who's on the call, and some of the folks from Alaska have really been, the trendsetters or the pioneers in this area in that. But I think one of the things that this collaborative has really emphasized too, I think your point about the community is so critical, and really listening to your elders. When you have those resident councils, talk to them. Find out if you have a diabetic class for your elders. Find out what they want, what's important to them, what's going on. Because it needs to be driven really from the bottom up, not the top down. It's great that we have these regulations or resolutions or laws in place, but Val's point was, get the elders to kind of speak out to what they want and pick one thing and really work on that to make it happen, like Alaska did seal oil. Val, did you want to comment on that?
Yeah, go back to Rendella's first point. One of the things I think may be beneficial for facilities is Alaska, under their food code, under the government, actually has a whole section on traditional foods. And that maybe could use as a model for other states. They've actually been extremely supportive, and I'll give kudos to the state of Alaska, but much more support than you would expect. Right. So there's a model out there for other states to follow if they want, and I'm sure the main contact from the U.N.I.T.E over here in Alaska would be more than happy to help out in that area.
Right. And we also that person that was at, remember NCAI, that in Arkansas, I think, Randella, that was trying to get a tribal food code for every state. It was a group of attorneys.
Uh-huh.
What do you know how they're coming along or what's happening with that?
I'm not sure right now what's happening with that, but that's good information to follow up on. I think we need to look into that further. Right,
and actually, I have her card, and I was actually going to see her. She would be willing to talk on maybe our December call.
Oh, that's a good idea.
And see if we could get that. It would be something kind of cool to end the year with. So I'll see what I can do on that.
Okay, great.
Debbie, this is Val again. Let me just go back to your other point. You had mentioned seal oil. And I think one of the lessons we are learning is there are people willing to help that you would not expect just to be part of it. Just for the background real quick, after we do the traditional foods here in Alaska for our facility, a lot of professionals put together a seal oil commission, figure out how to do it, and then we picked up the ball again. So we ended up getting two professors from University of Alaska at Fairbanks at Kodiak, who then referred us to a professor over at University of Wisconsin to help. And both of them said, we'll do it for gratis because we want to be part of this. Mm-hmm. Then the professor at Wisconsin took it one step further and did a presentation. Actually, he's doing it next week over at the CDC to his colleagues and say, how can we help Alaska? And I thought there's no amount of money I could afford to pay these people to do this. Mm-hmm. They're doing it for gratis. And I think as we do things with traditional foods, you know, people are willing, and I think part of it is to get their name on it.
Yeah.
So we actually have two professors coming next week to look at the whole process of how do you render seal oil, sending out the samples to Wisconsin, working with the state, and one way or the other, we'll know probably by the end of the year if it's a go or no.
That's awesome. And how long have you been in that process, Val?
I kind of picked it up with after the seal oil started, everything just kind of seemed to, everybody's just trying to figure out how do we get from point A to point B. One of the challenges was that there's nowhere to test, let's say, seal oil for safety. So we talked to the state lab. State lab said they're not permitted by the CDC to do it. So we talked to the CDC, and their attitude was, so their comment was, we're not going to allow the state labs to test your seal oil. It's expensive, and the reagents are only for cases of botulism or suspected, not to proactive testing. So we got very lucky. Finding a professor who said, why do lab work in the University of Wisconsin? And it sounds like a cool project. I'll do it for free. And we just paid for his flight out here. So,
and you've been at this for what, 2 years?
On traditional foods, about 2 years.
Yeah. And
the lesson to learn is, you can have 99 doors closed. All you have to do is find the one that's open.
Right.
And that's what we've been able, fortunately, to do. There's a lot of help to people willing to help, and it's just a matter of finding them.
Right. I agree. It's like a marketing campaign. You really got to talk it up. We just set our traditional foods committee for every other Thursday. So, get a time, get that committee going. Start inviting people in from the community. Start talking this whole process up. Questioning, what are we currently serving? What could we be serving? What do the elders really want? That type of thing. So, all right, thank you. Rangela, was there anything else?
Let me see here. There was, I think there's quite a bit of discussion. Well, it was concern about long-term care. I think there's always those issues about what alternatives there are to opening nursing homes in the regions because they're so expensive.
Okay.
And often not used by the local members, but people outside the community.
Oh.
And so that was a question that came up. But then again, we were also presented with the community-based programs that need to take on another level of evolution because right now they're providing nutrition primarily, the meals program, but in order to provide more full services so that we can keep elders at home and in their communities, that we need to expand some of those and look at creative ways of utilizing resources within the programs. And also there was discussion that there's just not enough funding in the Older Americans Act Title VI programs to meet those needs. So it has to be a program that's subsidized by other programs and funding services. So,
was there any talk about that kind of what people were saying about the kind of the relationship between, say, nursing homes and home and community-based services? Like, could those two interact a little more closely for services? Has that been discussed?
I know that they're calling it long-term care and long-term services and support. Mm-hmm. They're kind of pulling them together. Mm-hmm. So in order to prevent elders from leaving the community prematurely for nursing home services, that they are hoping to provide more services at the community level base. But there are going to be times when an elder reaches that, critical health area where their caregivers and family members can't care anymore for them because the care is just, a higher level of care, that they do have to go somewhere. And so that's still an issue. Do they go to the state programs, or are there other tribal programs that would be able to, that they can resource with? But I think that's a question that you're trying to answer too. And those are answers that we still don't clearly have right now.
Mm-hmm. There's no real models out there, are there?
I don't believe there are. I mean, I know that there's some that reach closely into providing great care, but I think there are some issues that still resolve around that. And I think it has a lot to do with the states and their willingness to collaborate and work with the tribes, and understanding and sharing resources and understanding the need for providing support programming and services to tribal communities. It seems like services kind of stop at the gate of Indian country, or the door or the boundary of Indian country, and I think we need to get beyond that and start collaborating with agencies and programs outside Indian country, because that's the only way we're going to be able to meet some of the needs internally.
Mm-hmm.
So we have a lot of work to do. So many issues. Mm-hmm. And elder abuse was another issue that came up, and it's like, how do we get a closer hand and hold on that? When U.N.I.T.E is taking on a task force to, or at least a committee, an elder committee, to kind of look into those issues, and they approved that resolution. So U.N.I.T.E is going to have to take that step forward and start consulting with our elders about how we can remedy those issues of elder abuse.
Okay, so what was the resolution exactly?
The resolution on elder abuse, that's the resolution specifically is instructing U.N.I.T.E to take the lead in establishing a committee within U.N.I.T.E with comprised of community elders, so that we can ask them questions about elder abuse. And there's also other mechanisms that we can build into working with our elders, because again, we make a lot of assumptions without actually talking with our elders about what their most critical issues are about elder abuse and how they define or how they see elder abuse in their community.
Yes, thank you. That's exactly right. So we don't want to just assume. Okay, very, very good. Very, very good. Okay, does anyone have any questions for Randella? Randella, if you don't mind, after the call, I'd like to call you just briefly. I have a quick question for you, but I don't want to take up time on this call.
Sure, not a problem. I'll be here.
Okay, so the next thing I want to go over is our annual meeting and the Long-Term Support Service Conference. So, Administration on Community Living, I've been sending out save-the-date cards. Hopefully you got it. Just so everyone knows what's happening in Marquette Hotel, Minneapolis, Minnesota, November 14th, 15th, 16th, 17th. There's 3 full days and a half day on Thursday. Quite a few of the U.N.I.T.E members will be there, and so we do have a presentation scheduled on kind of this very topic of nursing homes, the importance of them in terms of them being part of long-term support services. Val, myself, and Joseph Ray will be doing that presentation from 3:30 to 5 on Wednesday, November 16th. Tuesday night, November 15th at 6 p.m. at the Marquette Hotel. We are planning to have our annual meeting, just like we had in Scottsdale last year. It will be a dinner meeting. I am waiting to hear back from the University of Arizona GWEP to get funding for it. They have asked for an RSVP by November 1st. So if you will be attending this conference and will be coming to that meeting, it is very important that I know that, and I can give a hard number to the University of Arizona. So as far as I'm concerned, anyone on this call is welcome. So Teresa, you would be welcome. Randella, of course. You and Cheryl would be welcome. So please, spread the word. Let people know. Last year we had 30 people, and that may have been a slight anomaly. But I'd like everyone to keep in mind the work that Kay Branch did, and the fact that we're really trying to honor her with this dinner and say thank you to her for all the work that she put into with tribal elders, and to keep this collaborative going, to keep it strong, to keep it purposeful and useful, and to really reach out to a lot of other stakeholders for tribal elders and make their lives as good as we can. And one way we can do that is by showing up to these conferences and showing up to these dinner meetings. And I am asked John Johns to give us a call-in number. So if you cannot come that evening, I'm hoping that you'll at least be able to call in and be able to participate in that way. So we have a presentation. We're putting together a PowerPoint. We met last Friday to kind of talk about that. And there is an agenda for the dinner meeting that was sent out to everyone. But like I said, on the survey that you get from Lisa, please RSVP, or you can email me directly and just say, Debbie, I'll be there. So far, Tammy and Carly are coming from Montana. Val, you and is Helen, did someone say Helen was going to be there?
No, Helen will not be able to make it. Helen has moved on to other opportunities, so it'll just be me.
Oh, okay. So Val's going to be there. I haven't heard anything from David Hunt. Has anyone heard from David Hunt? Okay. I know that Lisa, did you say you were going to be there?
Well, actually, I was not, but just got approval this morning, so I will be attending.
Oh, that's wonderful. Okay, so Lisa will be there, Melissa, myself, Randella, I believe. I just heard from Dr. Blythe Winchester, who will be there. We do have a quick item here on who would you like for our speaker. So one of the thoughts that came up is we can have an elder speak, but we need to identify who that elder would be. So, Randella, that's what I was thinking. Maybe you could help us in that. Maybe there would be an elder who could say the prayer and who could maybe talk, someone who had some experience maybe in a nursing home or having a loved one in a nursing home, something like that. And then Leo Litsky, who was the administrator here at Archie and is now somewhere else. Lee is willing to do a panel discussion with Cynthia LeCount and Dr. Bruce Fink, who have both agreed to speak briefly. So my thought was we could have an elder do the prayer and speak, and then also have this kind of panel update. So any thoughts on that?
Yeah, if that's possible. I was going to say, Debbie, if we're not able to get a speaker, I was going to give you a name of somebody that might be a good speaker. I don't know if he's available.
Okay.
Dr. Gary Ferguson.
Okay.
He does a lot of work with facilities, traditional foods. He does the videos, the YouTube videos, Store Outside Door, where it talks about getting your food from outside. He's an excellent speaker.
Is he in Alaska?
He's in Alaska. He's at the Alaska Native Medical Center, I believe. Not the Alaska Tribal Health Consortium, I'm sorry, ANTHC.
Okay,
excellent
great.
Speaker.
Okay. Is he coming to Minneapolis?
I don't know if he is or not, one way or the other. I was just trying to figure out if he's on this list here. If he is, he'd be an excellent person to have.
Okay. Thank you very much. Anyone else, a possible speaker, or what do you think about having a short panel and an elder speak possibly?
Well, this is Lisa, and I'm always excited to hear the voice of the elders, so that's going to get my vote every time.
Okay. All right. Anyone else? It's our meeting, so, we can arrange. I mean, it would be nice to have someone, Val, on this traditional foods topic since we've been working on that all year. It would be a nice kind of closing summary.
Mm-hmm. Yeah.
So we can
just reach out to him to see if he's coming.
Yeah, can you do that and let me know, or just CC me on the email and I can take it from there? So if we cannot get Dr. Ferguson, we will work hard to try to get an elder. But what do you guys think if we need to have a plan B? Are you okay with having a panel discussion with Cynthia and Bruce and Leo Litsky? Are you guys okay with that, or?
What would the topic be?
Well, I thought it could just be a continuation of basically the conference is the importance of strong tribal nursing homes and best practices. And I was thinking they could be giving updates from their perspective as, working with tribes for many, many years, and from the IHS perspective, the ACL perspective, administrator perspective. I don't know, unless you guys have others, if you want something specific, then we need to ask them for that specifically.
That sounds fine.
Okay. Anyone else? Anyone have any thoughts on that? I mean, I want it to be about what you guys want. Okay. All right. Did anyone, that's fine, just so everyone knows, I'll be sending out more information, so watch for that. we will not have our November meeting. It will be that Tuesday, November 15th call into the dinner meeting if you can't come. So that will be our November U.N.I.T.E meeting. We will have a steering committee meeting, though, on Monday, November 7th, for those of you on the steering committee. And I was on the TTAG call in October and gave an update, and I will be on the call in November if they have that. And then our December meeting will be the third Thursday, which is December 15th. So we will have a December meeting, and we'll try to get a speaker for that. Real quickly, does anyone have a contact with the Oglala tribe? Oglala tribe in, is that in South Dakota? I think it's in South Dakota. Oglala. Does anyone have a contact for that tribe? Okay. I see they're supposed to speak at the conference, and I'm trying to get a contact. Okay. All right.
I think, this is Joseph. I think Cynthia would have a contact for us if we reach out to her.
Okay. I did send her an email last week, and I just didn't hear back, so I'll try it again, Joseph. Thank you.
Okay.
I'll try it again.
Yes.
So just one more quick thing. Is there anyone else on the call that didn't respond? And then I want to give Teresa a chance to introduce herself. And I apologize, Teresa, for not doing that sooner. Anyone else on the call? I've got Lisa, Joseph, Teresa, Val, Julie, Jonathan, Randella, and Debbie. Anyone else join the call? Okay. Teresa, can you introduce yourself and just tell us a little bit more about the Ombudsman?
So I'm Teresa Holt. I'm in Alaska. I work pretty closely with Lisa and Val. We're So I'm the state long-term care ombudsman. Every state has a state long-term care ombudsman.
Okay.
There's an ombudsman, so that sort of runs the long-term care ombudsman services in every state.
Okay.
Every state is different.
Okay.
Our state is very small, of course, because federal money is based on population. So we're 6 people in our state.
Okay.
We cover the whole state, which is about 268 nursing facilities and assisted living homes.
Okay.
And most of our budget goes to travel because we have such high places.
So are all ombudsman programs funded by state money? Is that true, or?
No, there's federal money, Title III money, and Title VII money.
Okay.
That comes through the State Unit on Aging.
Okay.
And so there is one in every state. Some states are central, like our program. I'm the boss of all the people who are ombudsmen.
Okay.
Some states are very different. Like for California, there's a state office, and then I think there's like 25 or 26 local offices.
Okay. Now, I've heard that some ombudsmen are volunteers. Is that correct?
So the federal program the idea for it was based on a small state staff and or local staff, depending on how big your state is. And then they would train volunteers, and the idea was that you could have a volunteer in each facility.
Somebody's got a lot of background noise. Go ahead.
So you would hopefully have at least one volunteer in every facility.
Okay, so the people that actually come out to the facility are probably volunteers, right?
It depends by state.
Okay.
So in our state, we have 30 volunteers right now.
Oh,
We've been working hard to build up our volunteers. But our state staff visit every facility at least once a year.
Wow.
The national standard for access is that you should be trying to visit each facility quarterly. But states like us Hawaii who have to fly. They don't give us enough money to do that quarterly. So, and some states don't have any volunteers.
Okay.
But that was the original idea, was to run it through a volunteer type program so that you could have local people who knew individuals who lived in the facilities.
So they would come from the community.
Mm-hmm. We recruit our volunteers from all kinds of places.
Okay.
Most tend to be people who are about 60-ish, 60 to 70, who have had a family member in a facility.
Okay.
That usually that family member's passed away, and so they want to do something, usually in memory or. But we also get people who are really close to their grandma, and their grandma lives in another state, and so they can't visit with her, and they just want to visit.
Okay.
Former nurses volunteer.
Okay. And how do you, just real quickly, because we're almost out of time, how do you see our U.N.I.T.E collaborative connecting across the country with ombudsman? In your mind, how could that happen? What would be the way we could do that?
Well, I think that there's definitely a need. So I visited, for example, New Mexico, and there's not a connection, a strong connection between the ombudsman and tribal entities.
Okay.
So I think we're kind of unique in that Alaska's unique in that sense that we don't have reservations. Everything's sort of mixed, and people are able to move freely around. Some of the issues are the same, but I showed up to Val's place and he took me to fish camp. So
you had a good time, didn't you?
I had an awesome time. That was the highlight of my trip, by the way.
Geez, I went to Alaska. I didn't get to go to fish camp. I just didn't go far north enough, Val. I'm coming back. Coming further north.
I was just going to add that I think a really great example of how certainly Teresa has helped me and helping our nursing homes is, for example, when her folks are on site, there was a time where they identified a need for some dementia training for a nursing home. And the nursing home said, yeah, we need help with this. We're just kind of struggling on getting some training for our staff. So Teresa reached out to me and said, gosh, we were in this nursing home and they were needing some extra help. So, I was able to work with the state and the Alzheimer's resource and some other folks and help them meet that need. But if we didn't have that relationship and that, that nursing home didn't know that I'm here, didn't know that Alzheimer's is there, didn't know that there are folks that are positioned to help, that wouldn't have happened. So I think the ombudsman is in a great position to be a strong partner with our work.
Yeah, and honestly, Lisa, in that model that you put out when we first started the collaborative, that had ombudsman on there, didn't it?
It's been a while since I've looked at it. I'm not sure, but it sure should have. Probably because Teresa is one of my main partners here.
Right, because I'm seeing kind of that circle there. You've got the tribal nursing homes, you've got the ombudsman, you've got the QAOs. Teresa, has there ever been talk about having specific ombudsman, just like tribal ombudsman? Has that ever, or it doesn't really work like that?
Well, so all I know is that some states hire people from the tribes to be their ombudsman for that reason. Okay. So in Alaska, that's hard because we only have 3 people who do the traveling. Okay. And we have 200 and plus tribes. Okay. So that was an idea actually that I was talking with Shelley about this morning, like how can we do that? But I do have a project that I would love to at least bring up as an idea that I've been working on, just started working on is
you got about 2 minutes.
Okay, every nursing facility has to have a resident council.
Okay, yep.
And resident councils are run in a very Caucasian way.
Okay.
And so I've started a conversation here in Alaska about how can we find ways to make that requirement, but make it be culturally appropriate because it's very inappropriate.
Okay.
It's basically, everybody gathers together in a room and talks about things that aren't going well.
Debbie and Teresa, that might be a topic that we can put for our U.N.I.T.E collaborative work next year.
Yeah, I think we should add that to the survey. Didn't you have a list of topics they could pick from on that survey?
Yep, and that was, I think
Let's add that. I'll put that in my notes too, annual topic. That's a good one, resident
Teresa,
council.
I'm assuming that's okay with you.
Yeah. I talked with Melissa Heflin, and then I also talked with Jordan, and I forget his last name. And Jordan was very interested in making that part of their curriculum that they're developing, and so I think it's a movement.
Who is Jordan?
Jordan Lewis. He's the PhD LU who spoke at the Spokane conference.
Right. Okay, I have his contact. Thank you. I just wanted to make sure. Okay.
Yeah, he's amazing.
Yeah, I need to get in touch with him too. That would be awesome. And if you look at our U.N.I.T.E brochures, one of the things is communication. So. It's 1:00, Teresa. Thank you so much. Please, everyone, seriously consider coming to the annual meeting. The dinner's probably going to be paid for. The conference is free. There's no charge. It's just getting there, okay, in the hotel. The blocks of rooms have to be booked by tomorrow on the hotel. I understand they're not available after that time. So make your reservations today. Send your pictures. If you want your facility to be represented in this PowerPoint we're doing, on the 15th, please send us your pictures of your facility, and we'll include them, okay? All right, thanks, everyone.
Debbie, I want to just mention something really quick. NCAI passed that resolution. I just found that out.
Randella,
it went through NICOA's elder approval, and then we submitted it to NCAI, and it's approved at NCAI. I'll send you copies of both so you can use that as your advocacy piece. Isn't that great?
Awesome. That's wonderful.
It is.
I want to make another poster just with that resolution and post it up. That's awesome.
Absolutely. And make sure you post with NICOA. NICOA elders are the ones that brought it to NCAI. So,
right.
And NCAI takes our name off, but we still want to show that we proposed it. It's the elders that proposed it.
Okay, very good.
You guys, and our collaboration with all of you, it was a part of their, authority and approval process. So. Okay, I just wanted to mention that.
And just so you know, we are going to have a table at the conference in Minneapolis. I asked for a table, so we'll have our brochures, and we'll bring that traditional foods poster and put that up, too. So people can see that. Okay.
This is wonderful collaboration. We're doing great, right?
All right. Good job, everyone. Have a great afternoon.
Thank you. Bye-bye.
Okay, bye-bye.